This is amazing. A Utah medical inventor has found a way to use smartphone technology to diagnose a patient's disease on location, almost anywhere in the world.
Probably about time for all that, isn't it? News specialist Ed Yates reports this novel approach to medicine could be the wave of the future.
Almost from the beginning of the classic sci-fi Star Trek, its writers envisioned a tricorder as a tool to diagnose the crew's health instantly, on location, no matter where they traveled.
I can fix that.
This will work with any type of smartphone.
While this smartphone is not a tricorder, it's about to take medical testing down a new path.
Kids are going to get a drop of blood.
Intermountain Medical Center inventor Dr. Joel Ehrenkranz draws a small amount of blood from Brittany, an expectant mother.
I mean a drop.
She's not in a clinic or a lab, but outside in a small park.
In this little holder.
He places the blood sample in a holder, then inserts the holder in a reader attached to a smartphone.
And then it's going to take a picture.
In 1 minute, the smartphone has the results of her blood hemoglobin. Within 15 minutes, it's evaluated her thyroid test.
And that's going to spit out a result.
They both came out normal and in minutes instead of having to wait for days or even months.
What we've done is to turn a smartphone into a clinical laboratory. We're going to hit that button.
For Brittany and patients like her,
I think it's great being able to do it on location, anywhere, save you time, save you money.
And save money it will. For Brittany's hemoglobin test, under $1.
And what we could do.
For the thyroid evaluation?
For under $10, what would normally take months and require hundreds of dollars. You've had a thyroid problem for a while.
For someone like Sandy recovering from a stroke and brain tumor,
we're going to get a drop of blood.
Bedside testing results are instantaneous.
It's amazing.
Here comes your result.
Hard to believe, but not hard to conceive in this high-tech age. So everything you see here, the significant data that is collected in a huge centralized lab, some 20,000 square feet, could be condensed down to a smartphone. And unlike traditional instant tests from urine and blood samples, this phone app interprets the results. Take Brittany's thyroid test.
And what we've been able to do has been to leverage the expertise of an endocrinologist by programming the thought process that an endocrinologist goes through in interpreting a TSH.
And the app can image and interpret many diseases: HIV, thyroid disease, syphilis, diabetes, adrenal disorders, malaria, kidney disease, infertility, anemia. The list goes on. In underdeveloped countries, smartphone point of care could save lives. In fact, Dr. Ehrenkranz got the idea for this new technology in 2007 while working on the border between Uganda and the Congo. During an Ebola outbreak there, he theorized the beginnings of smartphone technology then could evolve into an instant diagnosing tool for patients infected with this disease and many others.
Oh, don't be so melodramatic. You're barely dead.
The final frontier?
Anywhere.
While not quite Star Trek,
we know that works.
The journey is underway.
This is the future of medicine.
Ed Yates, KSL 5 News.
Unthinkable just a while ago, huh?
How cool is that? Yeah. So the dial rotary phones wouldn't do that.
No, I don't think so.
I still have one of those. Beautiful weekend.